Welcome, everybody. Thank you for coming. 2020 was a difficult year, not just for Allied, for the world, but Allied made it through by focusing on our values. Most importantly, the patient, but there's also teamwork and sacrifice and working together and thinking about the people around you and basically just pulling together. So 2021 is off to a little bit of a better start. Actually, let me introduce everybody who's going to be on the call today. It's Dr. Strauss from Strauss Allergy and Asthma, Dr. Erica Schwartz Cohen, who is family practice from the Allied Pediatric and Family Practice of Belmore Merrick. We have Dr. Scott Svitak, who is the head of our HR committee, the chairperson, of our HR committee, and a practicing pediatrician in Comac. So we're going to start with Dr. Strauss. We're going to move on to Dr. Schwartz Cohen, who's going to talk about what she's seeing in adults. Dr. Svitak's going to talk about the vaccine from an HR perspective, and then we're going to answer questions that everyone had the opportunity to submit. And I'm going to pass it over to Dr. Strauss.
Hi, thank you. Thanks for taking time out of your day to talk about this very important topic. As we all know, this is one of the two topics that everybody is talking about these days. I like to put things in historical perspective. We're not the first human beings that have had to deal with the controversy about whether to immunize people or not. One of my favorite historical tidbits is George Washington made the fateful decision to require an early form of inoculation of all of his troops against smallpox. He knew back then that infectious diseases was responsible for more deaths than any bullets or guns. And that decision alone may have been responsible for us winning the Revolutionary War. This graph shows very clearly what happened after the measles vaccine was introduced in the United States. This disease, which was responsible until recently for about 1 million childhood deaths a year, has now virtually disappeared, except for pockets where immunization has waned. For me, it's very personal. My parents were Holocaust survivors who settled in Israel. They lived in a small town where 6 children contracted polio and only one of them survived. That one was my brother. And because of his ensuing disabilities, they moved to the United States to get better medical care for him. And that resulted in his ability to walk better. And you better believe that as soon as the Salk and Sabin vaccines came out, they made sure I got my vaccines. Now, Jonas Salk, when he introduced the vaccine for polio, he tried it out in about 20 kids initially, and then he started a case-controlled trial of over 1 million children. So our parents and grandparents willingly subjected their kids to that immunization process because they knew the stakes involved. So when we're talking about those early vaccinations, we're talking about either live or weaker strains of the vaccine that had significant possible side effects. When we talk about COVID and the new Moderna and Pfizer vaccines, we're talking about really cool new and advanced technology. mRNA, messenger RNA, is being used in a whole bunch of vaccines and also may provide a response for cancer patients as well. This technique is really a step forward in terms of our technology because it relies on our immune systems and the cell's machinery to produce the allergen or the antigen that's going to prime our immune systems. So we're not getting the actual virus. You can't get sick from it. What they're doing is they're using a little snippet of the coding for a protein, the spike protein that attaches to the cell. On the lower part of the slide, in the gray area, you're going to see the outline of the nucleus. That's the walled off area behind which our mainframe computer sits. That's the DNA and all the genetic material. It talks to the rest of the cell via an intranet. It sends out messages called messenger RNA that encodes and manufactures proteins. That really is the basis of life. Our cells produce lots and lots of proteins that kind of send up signals about what to look out for. So the vaccine packages this little snippet of messenger RNA, which is very fragile, in a little fat globule. When you get the injection, it gets into the cell. Your cell manufactures those spike proteins. And to me, I think about it as sending out flyers and posters of the bank robber. This is the guy to watch out for. It sends it out through our immune system, and it puts it in the libraries, the post office walls, and the police department stations. And then everything kind of dies down a little bit, and everybody's kind of on the lookout, but they kind of forget about it. And then you get that second booster vaccine a month later, and that's when the magic happens. That's when everybody gets involved in the picture. You get your FBI, your CIA, the Army, the Navy, and you get the Marine Corps and the Navy SEALs all looking for this invader. So when it shows up at your doorstep in your respiratory tract, there is no way it's getting in. This vaccine so far has been proven 95% effective in preventing infection. That is astounding compared to other vaccines we've had before. Flu vaccine in a good year, maybe about 50%. Not only that, for preventing severe infection, the stuff that gets you hospitalized and causes death, the prevention rate is close to 100% based on the early studies. That's how we get out of this mess. So I'm really excited about this, but it's important to understand that there is nothing in this vaccine that is an antibiotic, a food allergen, or a preservative. The mRNA gets degraded very quickly. They just kind of tear up and destroy the message as soon as it gets into the cytoplasm of the cell. And there is no way that it can penetrate into the nucleus and change the engineering of the cell, so to speak. So although I kind of get it, we have anxiety about new medications. If you understand the technology, you'll really understand that it's very hard to imagine how it's going to cause any significant long-term side effects. Let's go on to the next slide. So what are the side effects? The side effects are the same as with any immunization. Sore arm is most common, but even with immunizations that we give, some people feel really sick afterwards. They feel like they want to lie down and go to bed. Fever, chills, aches, fatigue. That's not an actual infection, but that's part of your body's immunologic response that occurs in some people. There are rare side effects. So we have an adverse event reporting system. And when you look at many, many thousands of people who have gotten the vaccines in the early trials, you're going to see bad stuff happen. Most of it, we presume, are random events, but the epidemiologists and scientists that are looking at the data are looking for signals to see if it occurs more commonly in people who got the vaccine than those who didn't. So you will see reports like appendicitis, Bell's palsy, pancreatitis. All these things happen at random in the general population. My ongoing joke with patients is, if somebody gets into a car accident after taking a medication, it's going to be on the package insert. It doesn't necessarily mean it's a cause and effect relationship. What about allergic reactions? That has been reported. You can see severe allergic reactions called anaphylaxis with hives, trouble breathing, throat closing, wheezing after any vaccine. It appears to occur a little more commonly with this one. There have been about 2 million doses reported as of early January. Now we're up to about 29 case reports in the few million that have been given. That's an incidence of about 1 in 100,000. It is rare, unlikely that we're going to see it. And when we do see it, anaphylaxis is treatable. It's a bad couple of hours. You get an epinephrine injection and you're feeling better. All of the patients who experience this have recovered. We don't know for certain what is causing this, but we do have a suspect. And in that little fat globule is an agent called polyethylene glycol, which you may realize is in bowel preparations for colonoscopies and also in Miralax. I've been in practice as an allergist for about 30 years, and I've seen about 2 or 3 cases of anaphylaxis to this substance. If you have a history of allergy to penicillin or food allergies or other drugs, it does not put you at increased risk for anaphylaxis from this vaccine. So it's important to keep that in mind. And whenever you think about a new product or a new vaccination, you always have to think about, what are you actually treating? What's at stake here? And that's where you look at what happens with COVID-19. We know that the death rate is substantial. Erica and I can tell you from seeing patients on an outpatient basis via telemed that the patients who never get to the hospital are very sick. They describe being run over by a truck. I never want to get that sick again. And we also know that they're finding some possible serious long-term complications of the disease. They are now studying neurologic, heart, and other complications. So we need to keep that in mind when we're thinking about the theoretical risks of a vaccine versus the known risks of this really common, deadly disease. So the question comes up, who should get the vaccine? Thank you. This is how the pandemic ends. This is how we can do our part to end it, because the lives we now save not only are our own, but those of our family, our friends, and our neighbors. It is not yet approved for children under 16. There are studies underway, and I'm very hopeful that it will be approved within the next year. There is no data on pregnant women and nursing mothers, but because of the technology, the uniqueness of the product, and what is at stake here, the Advisory Committee for Immunization Practices and the American College of Obstetrics and Gynecology have both come out with a recommendation in favor of getting this vaccine. If you are pregnant or nursing, I would urge you to talk to your own doctor about it. We talked about allergies. So if you have a history of allergies to peanuts or shellfish or penicillin, you are not at increased risk as far as I'm concerned from anaphylaxis to the vaccine. If you have had the vaccine and had an allergic reaction to it or a known allergy to polyethylene glycol, you should talk to an allergist. Patients who are immunocompromised should definitely get the vaccine. Their ability to mount a response may not be as good as other individuals, but they really can't get sick from it. And the final and most important question is, what if you know you've already had COVID? Should you still get the vaccine? And the resounding answer, based on current data, is yes. We know that you can get this disease again. We do not know how long natural immunity lasts. And we do know there is no downside to boosting your immune system and getting all the troops in place and letting them know about it. So I'm going to turn this over to Dr. Schwartz Cohen, and she's spending part of her birthday with us to give us her wisdom and knowledge. So happy birthday, and take it off. Thank you.
Thank you so much. And I'm going to talk to everybody today a little bit about the actual virus itself and why it's so important that we don't get this virus, and also why it's so important to think about the risks of getting this virus and why it's so much better, just like Dr. Strauss said, why it's so much better to build up our immunity with a vaccine rather than getting the virus itself. So far, I've seen a lot of patients with COVID-19, and I personally have lost peers, friends that I graduated from medical school with, from COVID-19, with stroke, people my age, and I'm old, but not that old, and stroke, they died from respiratory illness, and it's very serious. So I'm going to tell you a little bit about what I've seen in patients and the way that they've presented to me, whether it's an younger adult or an elderly patient that I've seen either through telemed or actually seen in the office. So for starters, COVID-19 can start out with just like a flu-like illness, fever, cough, chills, all the things that we talk about, flu-like illness, but much worse. Not only is it much worse, but we can also have, if someone starts to become confused, we can also, it has been attacking the neurologic system, the cardiac, just like Dr. Strauss said, as well, a lot of patients with pulmonary problems. Now, it can start out with just a mild illness, and then even a couple of days later, patients are starting to have shortness of breath, increasing fever, pneumonia, where they either need to be hospitalized or even need to be intubated, as well as sometimes some of these patients don't make it as well, end up with death, unfortunately. So some of the things that I want to talk about is when we build our immune system, this way, this particular virus has been seen now to cause inflammatory response in our heart, in our lungs, neurologic in our brains, and it gives us an ongoing debilitating illness. Now, I've seen patients with pneumonia. I've seen patients after being intubated in the office. But some of these patients that are asymptomatic, and that means you get the virus because you're exposed, and asymptomatic patients are ending up with something called a long hauler type of syndrome, where even though they're asymptomatic in the beginning, they can end up later on, a couple of weeks later, with fatigue, different things like body aches, joint pain, shortness of breath. I mean, this can also occur with the patients that are actually ill, but we can also see it with patients that are asymptomatic, which a lot of patients are walking around and saying, hey, I tested positive, I'm fine, nothing's going to happen. But that's not the case, because some of these patients end up with cardiac issues down the road. We've seen changes in EKGs in these patients, even that are asymptomatic. And so the virus itself is causing inflammation inside the body, as opposed to the vaccine, which gives you the immunity so that if you're exposed down the road to the actual virus, you will then be able to fight off this virus without it incorporating into your body, causing this inflammation. So we don't end up with a long-term illness. So my point today is we want to get everyone the information so they understand COVID-19 and how it can affect so many people, especially, our high-risk groups, our pregnant women, our elderly patients, our immunocompromised, patients that are overweight, smokers. I mean, there are so many different groups that are at risk, patients with that have autoimmune disorders. A lot of different categories are at risk for this COVID-19. And not only that, you as a responsible adult don't want to give, even if you're asymptomatic, you can still give the virus to someone else, someone that you love, your friend, your patient, your neighbor, your loved ones. So, and they can end up with it can end up being fatal to them. So even though you may not have the symptoms itself, they can end up with this long haul syndrome. So my point today is to get out to you the information about how bad COVID-19 is and how the risks of getting that virus are so bad, but the risk to the vaccine is so minimal and the benefits are huge.
Thank you. As you can tell, the fact that we're here today talking with you, Allied Physician Group and Adjuvant Health, are concerned about the well-being of not only ourselves, our clinicians and doctors, but also our staff, patients, and as an outgrowth of them, their friends, family, and contacts and loved ones. It is because of this concern to ourselves and to each other that we are strongly recommending everybody get the vaccine. We have been willing to have these meetings and continue discussions to answer any future questions you may have. As the time comes, if and hopefully all of you do decide to get the vaccine, you will be eventually getting a card that looks something like this that will show you've had the vaccine already. And the vaccines currently are 2 shots. With that in mind, at this current moment, even if you've had the vaccine, the CDC recommendations, as well as the New York State Department of Health, everybody still needs to continue wearing face masks, socially distancing, try to be as safe as possible. Even if you've had both vaccines coming around, the recommendations are still to continue doing that.
Dr. Cohen, this came up from a few people. One of the first things that happens whenever people want to discourage any kind of vaccine is to say something that can't be proven but is devastating, right? So it's out there that this might affect fertility or future pregnancies. Can you comment on that?
Well, first of all, if you're not here, if you're sick, you can't even become pregnant if you get the COVID virus itself, because it can cause damage to your organs as it is. There's no data showing that there's any that it affects infertility, because the vaccine hasn't been out there that long enough. So there's not enough data to show anything. There hasn't been any cases where there's been infertility because someone received the vaccine. So wherever they got that data, it can't be true, because there's no data yet on what has occurred from this vaccine, because the vaccine is new, number one. Number two, it's so important that especially pregnant women get this vaccine. Because the virus itself can cause preterm labor and complications during pregnancy. So important, even that pregnant women, because they're at a higher risk as well. Important that they get the vaccine.
Thank you. So Dr. Strauss, so this brings up the question, isn't it just too new? Like, wouldn't it be better just wait a month or 2 or 6 and let a whole bunch of other people get it and then get the vaccine?
Okay, so a whole bunch of people have already gotten the vaccine. We're talking about millions of people around the world. And usually when there are side effects of the vaccine, it shows up within the first couple of months. And then you're talking about a tiny little piece of the protein that is produced on your cell surface compared to the entire virus, which we know can wreak havoc on your system. I'll take my chances with the vaccine rather than the virus.
Excellent. And all of us here have been vaccinated. Yes, all the doctors?
Absolutely.
Yes. Okay, excellent. So Dr. Strauss, again, you talked about the efficacy of the vaccine being 95%. That's after 2 doses, yes? So what's the efficacy after the first dose, number 1? And a lot of us have not gotten information on our second dose yet. So what happens if we don't get it in that tight time frame that they're suggesting?
Okay. I'm not 100% certain of this, but I believe there's about a 50% efficacy after the first dose. So it is helpful. And if there is somewhat of a delay between the first and second dose, you're still better off getting that first dose and get the second dose as soon as you are able in that period where you're supposed to. So for the Pfizer vaccine, you're supposed to wait at least 3 weeks. For the Moderna, it was studied at 4 weeks because it's giving your immune system a chance to get primed. And then you want to just kind of spurt it onwards from there. So yeah, I have not scheduled my second dose yet. I was told I could not yet. So I'm anxiously looking forward to that as well. But get dose number 1 in if you can. Right. And I think down the line, there's going to be much more availability, and there may even be other options for us as well.
Right. You also raised an excellent point, right? The 21 days, the 28 days, that's just how they happen to study it at that moment. Right? It doesn't mean that it might not even be better if we end up postponing it a little bit. Like, we can only go with the science that we know at the time.
That's correct.
Right. Dr. Cohen, what about the new variant? Do you think that this is going to cover that new UK variant and any other variants down the line?
I do believe it's going to be able to cover it. I don't know how well it will, but we've only studied right now the older variant, but I feel that if, with any virus, viruses mutate at all the time. So like when we have a flu virus, by the end of flu season, we need a different vaccine. So next year they're going to have to come up with a new vaccine in order to cover the new variant. But I feel that there's going to be some type of coverage do you agree with me, Dr. Strauss?
Yeah, I wanted to chime in. We know that the new variant has the same spike protein, and that is what the vaccine is geared up for. So the vaccines that we have today will work for this new variant. If other variants come out down the line, we may have to modify our vaccine technology. And the beautiful thing is that we have the scientific ability to do that. So it really is an amazing and fantastic technology. This is a modern miracle of medical science that we are witnessing.
Absolutely. The newer vaccines with the mRNA, they're able to produce these vaccines so much quicker than they did back a long time ago, like they did with polio, with the attenuated vaccines and other vaccines. Now we're able to make this spike protein and reproduce it and on larger scales in such a quicker and it's a finer amount of time, so that we can get it out there so that we can end this pandemic.
Yeah, I was talking to somebody non-medical who was, distrusting because it happened so fast. And I was explaining the new technology. And, I said, if you go back 10 years, uploading a document, because we were talking about documents, used to take 15 minutes. Now it takes 5 seconds. We don't distrust the document. We understand that the technology is better and now we can do things faster. Plus, they eliminated a lot of the red tape and the administrative burden that goes into vaccines, but they actually did run the trials. Everything that was required for any vaccine, happened for these trials. What else? So Dr. Strauss, do you think there's going to be the need for another vaccine next year?
Well, as you pointed out, we don't know how long the immunity from the vaccination will last. They are studying that. But based on what we know now, we suspect that it's going to be good for at least a year or two. And then, it's anybody's guess how this virus will go and how it'll mutate. But they are studying the variants. So just like we modify our flu vaccine every year, if we need to modify this vaccine in the future, we have the technology to do that. But what we have now is safe and effective. And I just, that's a point that we need to convey when we're talking to other people about it. When you understand the real science of it, and when you understand how well it's been studied, this is really fantastic technology. And this is how we get out of the incredible mess that we're in today. And just like I showed you that chart with the drop off with the measles, I'm really hopeful that we're going to see the same thing with the coronavirus.
Yeah.
I think the other thing is people are very scared to get the vaccine because of side effects, and they're looking to turn to somebody to say to them, go ahead and do it. So I know that I've received so many texts, so many calls, so many people that reach out to me like, should I get the vaccine? Should I not get the vaccine? And of course, I've been putting all over social media that I've received my vaccine. Go get your vaccine, because they're looking to someone that they know, someone they can relate to, someone that they trust, someone that's their doctor, their friend, someone that they can turn to and say, what were your reactions? They can ask them personal questions. Were you able to do this? Were you able to exercise? Were you able to take a bath right after? Were you able to go to work after? All those things they worry about. So little or no reaction to the vaccine personally, and go get your vaccine. It's so important so we can end this pandemic, so that life can be what we used to know it.
And it's really important for this audience, particularly, to get the word out in their communities among their friends, because we are at the forefront of immunization. We're saving lives by doing that. There was a question about what to do if you're on an immunosuppressive drug. Do you hold the drug for a period of time? I would defer that question to the specific doctor giving the medication, but my own philosophy is just get the vaccine. You can't worry about the timing as much. So if you're not mounting as much of an immune response as you should be, at least you're doing something. So we don't know how effective it'll be in a given individual, but I don't see a downside, and I don't see withholding medication to get the vaccine.
So far with my elderly patients or patients that aren't chemotherapy or anything like that, they have not withheld any medication, or even patients with biologics such as Remicade or Humira. They've said, just go get the vaccine. And whatever immune response you get is better than nothing. And we need to get you that vaccine, but stopping the treatment might further along their illness. So they don't want to stop any treatment. So they felt that the risk versus benefit, get that vaccine and build that immune response, whatever you can do.
Great. Dr. Strauss, do we know anything more about the vaccine and preventing asymptomatic spread?
That's being studied right now. It appears that you can asymptomatically spread the virus. It may reduce that rate from the studies I've seen maybe by about 50%, but you still may harbor virus in your respiratory tract even though it doesn't attack you. But again, a vaccine is only as good as the number of people who get it. So the more people in the community get the vaccine, the better this vaccine will work, just like any other.
So Dr. Svitek, there were a lot of questions about when do we think that the vaccine is going to be more available to the general population, right? So we've gone from coroners and morticians and ICU workers to outpatient. We've hit 75, we went down to 65. We're now, I think, over 65 and some sort of comorbid risk factors, which when you look at those, by the way, are huge. Including smoking, I believe, is now counted as a comorbid factor, which is a little aggravating that people who smoke are going to go to the head of the line, but that's a separate discussion.
How soon until we all are able to get this? No idea. We're waiting for an increased production, seeing statistics with the numbers that the governor just recently changed, including the immunocompromised or immuno-issued people 65 and older. We already have over 7 million people eligible for the vaccine out of about 19 million people in this state. So as each stage comes, we are more getting eligible. At this point, it's just a matter of vaccines getting out so that we can set up a system to get the vaccines into the arms of people. And as Dr. Strauss said, we're on the cusp of more vaccines, which may be more readily available, easily given, don't need the negative 90-degree freezer to be stored. That's going to make transportation and use by everyday doctor's office that much more easier and that much more efficient for everybody to get their vaccine.
Dr. Cohen, if you've had COVID, I know we said you should get the vaccine. Is there a time frame that you should wait for? And I will add, by the way, that the Medical Reserve Corps, their list says if you've had it within 90 days that they won't vaccinate you, which I know is not a CDC recommendation, but perhaps due to supply.
But also Dr. Fauci had said that recommendation of 90 days also on TV.
From what I understand, 2 to 4 weeks after virus, you can get the virus. You can get the vaccine. Dr. Strauss, do you agree with me?
Yeah, the vaccine is immunogenic, and there have been studies that show that the majority of people have antibodies for at least 90 days, perhaps even longer. But we don't know in an individual how long those antibodies will last. What is the protective antibody level? What are your other immunologic cells like T cells doing? That's all uncharted territory. So, again, I think that if you've just been sick and you want to be kind and defer the vaccine to somebody else who's in a higher risk category, that's fine. But bottom line is, I would not count on having had it before to protect you for the long haul.
Now, if somebody had the virus and they have proven proven antibodies to the virus, should they still get the vaccine?
Absolutely.
Is it safe? Do we know it's safe to do that?
We don't know how I don't think we can get a titer on what their level of antibody is, and I don't think the antibodies stay too long enough that I would still recommend the vaccine. Just like if you had the flu, you should still get the flu shot.
I saw something, a question that maybe we've kind of answered, but Dr. Strauss, there was a question about, well, how long will the antibodies from the vaccine last? Like, are we sure that that's getting us somewhere?
That is being studied. The data that I saw from Moderna, they're confident that based on the half-life, they think their immune response is going to last for at least a year and hopefully 2. So, but we'll see in the future whether we're going to need a booster vaccine for this.
Okay. And between Moderna and Pfizer, are you picking a favorite horse or?
No, you get whatever vaccine is available. They are so similar that there really isn't any significant difference in the immune response, just in the way it's handled. The super cold temperature that you need for Pfizer and the distance between shots was studied at 3 weeks for Pfizer, 4 weeks for Moderna. As I said, we're going to have newer vaccines like the Johnson & Johnson vaccine coming down the pike as well. So they're going to have more opportunities and more issues, but just take whatever you can get when you can get it. That would be my advice.
Okay, so since this is a pediatric group, I'm going to end with you get what you get and you don't get upset. Thank you, everybody,
you so
for
much.
joining us today. Thank you, panelists, for giving us your expertise. Again, any questions, any one of these panelists would be happy to take an email or a phone call from you. And I'm sure that your providers, your clinicians at your main offices would be happy to talk to you as well.
Absolutely.
So thank you, everybody.